Welcome everyone to today's webinar, Patient Access 2.0, Enhancing Revenue Capture while Driving Digital Engagement with Intelligent Automation. On behalf of Becker's Healthcare, welcome and thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Finally, if at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box. At this time, it is my pleasure to introduce our presenters, Suzanne Katz and Dane Hoffman. Suzanne leads Notable's Access and Engagement Solution Development, where she aligns digital solutions with intelligent automation to support daily healthcare operations and improve patient outcomes. Formerly working as an administrator at top healthcare organizations, including Johns Hopkins Health System and the Hospital for Special Surgery, Suzanne directed operational and digital access initiatives, instilling best practices across service lines through facilitation of clinical, administrative, and technical partnerships. Suzanne holds a degree in design and environmental analysis from Cornell University and a Master of Health Administration from the Johns Hopkins Bloomberg School of Public Health. Dane has over a decade of experience as a revenue cycle consultant, and his expertise lies in helping hospitals and health systems identify and implement process and operational improvement opportunities, increase standardization, monitor vendor relationships, and evaluate performance. With a focus on root cause identification and collaborative problem solving, he has delivered improvements across all aspects of revenue cycle operations, including financial clearance, patient access, care coverage billing, payer follow-up, cash posting and credits, customer service, and pre-collection. At Notable, Dane focuses on the revenue cycle continuum, leveraging digital solutions and automation to improve patient outcomes, increase operational efficiency, and drive financial performance. Dane holds a degree in healthcare informatics and a Master of Business Administration. Suzanne and Dane, thank you so much for joining us today. I will now turn the floor over to you.
Thank you so much for joining today's webinar. And I'm happy to be here with my colleague, Dane Hoffman. We'll start today's presentation first talking about how digital access is truly the new expectation for patients receiving care. Then we'll talk about how revenue cycle capture goes wrong on the front end today. And ultimately, we'll end with some best practices for transforming patient access, as well as some time for some Q&A. So let's get started. Even a few short years ago, patient access had a very different outlook, and in many ways, a very different function. But as we think about the ways that patients access care, it's now expected that there's a digital solution on the front end. However, just because a solution is digital doesn't mean it has the intelligence to drive outcomes. It's reported time and time again across industries that consumers expect a digital experience, and healthcare is not an exception. Nevertheless, and in many ways, the industry is behind. And since we now consume so much information digitally and interact with tools on a daily basis, it is many patients questioning why we use online channels for everything else. Think about it, from education to banking, but not when we think about healthcare. It's no surprise that we want the same type of experience when it comes to receiving care. While there's already been significant investment in digital, particularly hundreds of millions on EHR, portal implementations, point solutions, we still see that most patients are not utilizing digital tools that are offered to them. However, 86% of healthcare organizations view patient engagement as critical to their operations as they're looking forward in 2023. We see that this lack of digital engagement with most patients visiting a portal less than 2 times per year, and over a quarter of patients just don't use it at all. Many portals aren't easy to navigate and might provide important information, but patients sometimes find that there's little insight as to what the information provided on the portal actually means. Yet many large health systems make significant efforts and even support large outreach campaigns to encourage enrollment and utilization of portals. When you look at the numbers side by side, you can see that there's a disconnect between what we're delivering to patients and what they're actually using. So if patients aren't using portals, we wanted to know a little bit more why. So we launched our own national survey to understand this more, and it should be no surprise that nearly 2/3 of patients say that providers' digital tools don't meet their expectations. And worse, while you may be able to see information or a test result or that you're due for a screening, you can't actually act on that information within the portal. 3/4 of the time, patients tried to do something online, but they still had to make a call to complete the task. After running call centers for years, it's very clear that adding more phone volume is only adding to the ever-growing work administrative staff is currently doing and creating an experience that isn't delighting patients. When we think about just a simple function like completing check-in, we're finding that most patients are still performing that activity at a front desk. You can easily see in the last several years that the work at the front desk has really increased exponentially over time as we collect more and more information from patients up front. We've moved so much data collection to the front end that patients are spending more time at the front desk and waiting longer times before their visit. We shouldn't be surprised that the perception of waiting time for patients is changing and growing because of all this upfront activity. In addition, all that activity can cause delays in patient being able to see their provider timely and spend that quality face time with them when receiving their care. And furthermore, we know that access can drive patient loyalty. Approximately 80% of patients would consider switching providers for convenience factors alone. Just an increase of patient loyalty by 5% can result in a 20% increase in profitability. We may have previously thought of patient access as only a way to start a patient's experience with the health system, but we're seeing that can actually be a deciding factor if they're going to stay with that healthcare organization. And so it's clear that there's this misalignment between the perception of our healthcare organizations and our patients. Patients want a personalized and seamless experience to ultimately streamline the process of getting care. And healthcare organizations need to have the ability to collect important information prior to a visit. But ultimately, we want the same outcome. Patients want to receive high quality care, and healthcare systems want to be able to deliver that care. Given the financial pressure that healthcare organizations are facing today, they need a way to collect high fidelity data on the front end to lead to strong financial outcomes. And more so, to provide a comprehensive experience for a patient, we have to consider not only how we provide care for them clinically, but how we can provide resources so they are supported financially when receiving care. So let me pass it to Dane to talk more about the front end of the revenue cycle.
Thanks. Suzanne did a great job teeing up sort of what the patient access with the front end environment looks like from the patient standpoint, why it's so important. And as we continue the conversation, we're going to focus more on what that means to revenue capture and why the front end is so important. This is something we know in the revenue cycle and we've talked about in the revenue cycle for years and years, but there's so much more of a focus on it now, as we said, around patient focus and the challenges that we face in the current climate. So the first thing we're going to talk about is just front, middle, back. We all understand this. We know that what we do on the front end is going to have downstream effects on what we do in the back end of the revenue cycle. But the thing I really want to call out here is what the front end is today and what we're hoping to make it and what Notable is leading charge on making it, but what we need it to be in the future. And ultimately, the front end is still very highly manual. And you might say, well, Dane, Suzanne just had a slide that said 68% of hospitals, health systems are saying their digital transformation is on schedule or ahead of schedule. But there's a big difference there in digital transformation in what we're looking for and what we need in terms of not having manual work. And that key differentiator is digitization versus automation. So you're going to hear me talk about that throughout this portion of the conversation today. But much of what we're doing in the healthcare space and that digital transformation we're talking about is digitizing work. It's not automating work. So an example of that digitizing is we're taking paper processes and we've now put them into EHRs. We're populating work queues. That's great, but that's not automating the work. That's not automating the processes. So digitizing is a huge step forward for healthcare, but it's still not helping us alleviate the challenges around high fidelity data and around capturing that data in a way that is desirable for patients and less work on staff, i.e. the automation piece of it. So as we move forward, we're going to get into a little bit more about why now is the time, and we've hit this fork in the road where we really have to focus on automating. There's two challenges that are very key. We all understand these challenges. You're living them every day. We're seeing this in the industry. We're seeing our partners go through this every day. Labor shortages, are number one. So we hear a lot of media coverage. There's all sorts of conversation around the clinical labor shortages. But this is something that's propagating across the entire healthcare spectrum, including revenue cycle and our administrative tasks. So as we see here, 90% of CFOs actually report labor shortages within the revenue cycle. And then the denials, this is absolutely not something new, but we're hitting that fork in the road where it is becoming something that will be insurmountable if we don't do a better job getting out in front of it. And when we talk about denials, they've been continuing to climb, but obviously the portion of those denials allocated to the front end and those type of issues is what we really want to try to focus on with the automation piece when we're talking about patient access and digital engagement. So why is now the time? Because again, I would say we've talked about those issues before. Anyone who's been in revenue cycle for any amount of time would be able to say, well, we've always had staffing shortages and denials has always been a problem. But the issue is the persistence of these staff shortages. There's really not an end in sight to that. There's kind of no end or light at the end of the tunnel, if you will. And much of that is allocated on how much responsibility we're putting on the staffs. And as we think about this, if we're digitizing work, again, back to digitization versus automation, when we're digitizing work, it still requires staff to do some kind of manual trigger. Staff has to start the account, staff has to work the work queue, staff has to manage the work queue. So whatever's going on, we're still relying on staff to do so. So as the complexity of EHRs, as the complexity of the compliance environment, as complexity of payer regulations continues to grow, that digitized environment just means we have more complexity falling on the staff. So as we see this, these staffing issues continue to prove out or be an issue within the current economic climate, as the complexity continues, it's not going to go away because we're still asking our staff to do much more work just in a digitized format. We pulled a quote here from HFMA around the staffing environment and kind of what we see now. And ultimately, the two things that I've talked about are highlighted in the lighter blue there. One, we're just unable to find enough people that are willing to do the work. That is, you could say, part of the economic climate, part of the challenges that we may be able to weather that storm. But ultimately, the second part of the quote, we have this great opportunity now to really utilize technology and not just digitize the work, but automate it. So that way we can have actually have less staff doing more work because the staff are focused on the work that really requires their intervention and not all the manual work that we can automate with good processes, with intelligent automation, with artificial intelligence, et cetera. And on the denial side, we know denials are climbing. This is no surprise to anyone on this call or anyone in the industry. We know payer complexity, payer regulations are climbing. We know government regulations in compliance are climbing. So as we see denials continue to trend up, again, we have to focus on how can we improve this and not just throw more bodies at the situation. That's why we're at this fork in the road. We need opportunities. We need to take advantage of the opportunity now with digitized environments, digitized EHRs. Now we can automate these processes and not just have our staff working in a digital environment. And I think the next slide will actually show something that I think is very helpful in terms of the emphasis we've mentioned. We had this pulled out earlier. 41% are allocated to registration eligibility denials. And if you look at these categories, you could even say some of these other categories, there's probably some of those that are related to front end. The one that really sticks out is services not covered. That's something that ideally we could catch on the front end, and we should be catching on the front end. So when we think about the front end, we know registration eligibility is 41%, but even some of these other categories are things where the front end can have an impact if we have solid front end processes, if we're able to automate, put guide rails in place so we're getting the right data and we're doing it in a way that's delightful for patients and makes our staff workload less and easier so that they can focus on the really complex examples. This slide really just highlights what happens as we go downstream. I think everyone probably knows this, but it's good to call out, and it's something we always like to highlight. The first piece I talked about, safeguards around collecting high fidelity data in the registration in authorization space specifically. If we don't collect that data, we're going to initially have rejections and the rework that's associated with those, even to get claims out the door. Then the second piece is obviously around denials, where we've already talked about that extensively, the denial that where we may not get paid if it ends up in a write-off, but at the very least, we're doing rework on those. So I think the next slide is actually a really good way to capture what we see and the challenges with how we're leaving money on the table. And I'm going to call out one. There's a lot of metrics here. You can read the slide, but the one that I'm really going to spend time on is the 60% of denials. So the fourth one from the left, 60% of denials are never worked due to lack of time or knowledge. And I'm going to say most of that is probably lack of time. Anyone that's managed or worked in a PFS shop, anyone that's worked on a consulting project around denials or an internal project around denials knows that we're always focused on the highest value denials. We should be. That's what makes sense. We want to make sure we get that denial for the $100,000 inpatient claim overturned and paid, more so than the $250 office visit that might have got denied because we didn't capture the correct data on the front end. So obviously we know the focus is going to be on the high dollar accounts, but that leaves this huge amount of denials that we may never even have the time to get to and are just written off due to time, due to maybe not a lack of knowledge, but usually time. And as you see on the last item there, at least a $25 worth of investment to appeal the denial. So when we're talking about small denials and $25 worth of staff time to appeal them, obviously sometimes the economics aren't there. So we need to flip that thought process and say, how can we resolve these denials, the front end related denials, so that now we don't have this huge population that we're not even getting to due to lack of time. Those are the denials specifically when we talk about the front end ones that are ripe for automation, that are ripe for intake solutions that can improve the data validity or high fidelity data. You'll hear us use both of those terms a lot, but improve the data that we're receiving in that registration and ensure that we're not getting these denials downstream, particularly those high volume denials that are lower dollar that we know we're not going to have the ability to work. So we're going to now jump into some best practices for how we're transforming patient access. And Suzanne's going to walk through some of them. And I have some case examples and some studies that we've worked with. So we're going to kind of go through some of the high level and then jump back into some details behind some of our case studies and what we've done with some of our partners. Suzanne, I'll turn it back over to you for a bit.
Thanks, Dane. Appreciate it. So let's start outlining how we can solve some of these problems and create that strong patient experience while obtaining also strong financial outcomes for, what organizations are looking for, so we break it down into three simple areas. Of course, the first is to remove those internal barriers to transparency. The days of not having patient access and revenue cycle work hand in hand are really gone. They have to work together to ensure that patients get the care that they need and that organizations are set up for sustainability as well as growth. We also have to think about not only meeting expectations for patients, but truly exceeding them. We mentioned before, knowing that their loyalty and satisfaction to this process is truly crucial for these organizations. And finally, we have to think about how we're going to solve for the problem of administrative burden. We know that there aren't enough individuals to complete all the work, which means we have to change our approach to what we've done previously for getting that work done. So of course, there's a question of where do we start for this? How do we start removing these barriers to transparency between access and revenue cycle leaders so that they're truly able to work hand in hand? Of course, it's first understanding that what each group's constraints are and where there's opportunities for efficiency, as well as understanding that there doesn't need to be these traditional silos between the front end and the back end of the revenue cycle. Of course, this has to happen with regular communication and alignment between multidisciplinary stakeholders. And when we think about deploying an intelligent solution, it's about having all the right stakeholders at the table to ensure that there is that alignment. And that every group also really understands they're important in the process. Can't underscore that enough, making sure you have the right stakeholders at the table and everyone is having that collaboration. For example, one common thing that comes up when we're supporting organizations with this is how do we actually provide patients with estimates, for example, on the front end? Traditionally, this wasn't a role for a front desk or a patient access staff member. And now it's part of that patient expectation of knowing what their estimate is. And also there's regulatory around that as well. So that collaboration between all the different parties is really necessary to achieve these process changes and ultimately drive those outcomes. We're already seeing some significant progress when solutions pull those revenue cycle activities forward. Patients are happy to engage when the experience is personalized for their needs. This shows up in some of our data around upfront payment collection. So in this example, you're seeing that our customers report a range from a 40% increase to 130% increase, with a weighted average of 76% improvement in pre-visit payment collection. That is significant for all of our organizations. And they're seeing clear performance gains, while this is also opening up staff capacity when that patient access team no longer needs to perform these functions during check-in. And then, of course, we want to talk about exceeding expectations for patients. What does this look like? And we know patients have trust in their care providers, right? But they should also have trust and confidence throughout their entire healthcare journey, from the point of scheduling through the time they complete an appointment and actually leave that facility. Many times patients are receiving care because, frankly, they're going through a very difficult situation, and every patient deserves the highest quality experience throughout their journey. And that's honestly where that personalization is so important, and where we need to ensure that every patient has a unique experience that isn't repetitive, that doesn't ask for information that doesn't apply to them, and helps prompt action to actually prepare them for care. It's about that guiding them along the way and making those recommendations as appropriate. For example, recommending a payment plan, or knowing when they qualify for a new clinical trial, or prompting them when they're overdue for a preventative screening. All these options are going to enhance their experience and ultimately provide organizations with valuable information to ensure that the care that they provide meets the highest standing. And by no means is this an easy task to accomplish. When you think about it, if a staff member had to pull together all this information that I just mentioned, that would require an extensive amount of time. And that's truly where intelligent automation can ultimately lead to an experience that every patient deserves. And we're very happy to report that we're actually seeing those results with our partners.
Yeah, I'll jump in with a couple of the case study examples you have. The first one we're going to talk about is Intermountain. And in this case, it was really repetitive manual processes within the check-in, a lot of what we talked about throughout the conversation today. And Notable was able to roll out our digital assistants, performing that administrative and clinical intake within the EHR, and doing so in a very short period of time as we rolled this out. You can see the results on the right side of the screen. Obviously, huge MA savings time, a very high patient engagement rate, extremely high patient satisfaction, which is one I really want to focus on. everything that Suzanne just talked about in teeing up the conversation today, and then also focused on that ability for patients to feel welcome, to have that remembered experience. That's the key. Obviously, if we're at 98.6%, these patients are feeling that welcome experience. They're happy with that experience. And ultimately, when drop down to the 300% increase in payments, that's going to drive payments. That's going to drive financial value. So not only are we having a better experience for the patients, where we have some of those guide rails that I talked about with denials in place on the front end, patients are going through that with that remembered experience. It's a delightful experience. It's a good experience. And they're more likely to then make those payments upfront as well. So a huge piece of the pie is having that experience that patients find delightful, that's remembered, and that they are then welcome to engage in. And the second piece we'll talk about is more around the ability to kind of solve that administrative piece. So the first case study we talked about was more around the patient side of things, though obviously we allude to and talk about how the solution puts that information back into the EHR. But what is the problem with the administrative burden? I talked about this a lot, particularly around staffing. And then the staffing issues leading to more denials as we have overworked staff. We don't have enough staff to complete things. Maybe we have lower quality staff because we've left some of our high performers have left the organization just from burnout. So ultimately, as we think about pieces of the financial clearance process, we usually see across the industry, across potential partners, and across people we've partnered with as we help them navigate this process. There's often different vendors or different point solutions, whether it be a vendor or sometimes even kind of a home brew, something they've built out themselves, that are doing these different functions, demographic, eligibility, et cetera, across here. And ultimately, this comes back to that comment around, or that point around, digitization versus automation. As we can see, we're highlighting, this is great that we've digitized these functions, but ultimately that still means we have staff doing this manual work. So how do we alleviate that burden? How do we pull that off the staff? And that's really what Notable is focused on. Here you can see we're looking to create digital assistants. We've created digital assistants in our intake solution, in our full suite of solutions, which can actually complete this work. We automate these processes. So now our staff are focused on the high value, high dollar, high touch accounts versus the manual accounts, or versus the very manual process working volumes and volumes of accounts. So this is really what's important. We're looking to take the digital assistants and make that an easier process for staff, make the process very simple and easy for patients to run through so that they'll engage in it. And then that will help us drive results both financially as well as on the patient side, the patient experience, and then obviously help our staff with the burden of doing all this administrative work that they have traditionally done and still have to do even in the digitized environment. And the last case study we'll go through is one of our partners, Austin Regional Clinic, ARC. So this one was more around two issues or two things I'll highlight. First, the challenge at ARC was they had actually rolled out an EHR solution for check-in, but we're only having engagement around 20 or 25%. And obviously, if we're only engaged at 20 or 25%, we're not seeing the benefits of that solution that we really need in order to solve staff issues. In fact, sometimes with low engagement in digitization only, we're actually causing more issues for our staff to have to do, because now we have more work queues. There's so many different points of entry. There's so many different things populating the air work queues. So we might actually be adding staff to our work plate, which is obviously not what we want to do. So what we are able to do with ARC is roll out our intake solution, get a very high level of engagement at 74, 78%, actually completing that in a touchless way. Registrations completed touchless at 78%. And then also same level of patient satisfaction. We talked about 94%. So we're obviously patients are very welcome, enjoy the experience. But the thing I wanted to call out probably the most on this slide is the 50% reduction in eligibility and registration related denials. So that really ties to the emphasis that I was talking about earlier, where we have these denials. We know we can't rework so many denials. so many go to write-off just based on we're focused on the key high dollar ones. So this is that great case study, that great example of where when we get a solution in place that really makes the registration simpler for the patient, simpler for the staff, and increases the fidelity of the data that we're receiving, we can decrease those denials, which are ultimately going to lead to great results on the back end, where we're not working those, we're not reworking those denials and have that inherent cost. And we're obviously not ending in write-offs. That's what we had to run through the case studies. I think we probably have some questions, can probably open it up. I think Lucia, you actually probably have the questions in the queue there. So if we want to go to that, I think we're good.
Awesome. Thank you so much, Suzanne and Dane, for sharing how leading providers can harness intelligent automation to really improve front-end revenue cycle performance with fewer staff, and also deliver a convenient, patient-centered experience that drives loyalty. And thank you to our audience for your thoughtful questions. If we're not able to answer your question on the line today, we'll follow up with you after the webinar. Okay, so first question that we have today is for Suzanne. Does Notable integrate with the EHR, or does information collected need to be entered by staff members?
Oh, good question. Yeah, this is a really important point as we think about saving staff time and ultimately driving those outcomes. So Notable is EHR agnostic. It is fully integrated with the EHR. We work with a variety of different EHRs across our partners. And that integration is crucial, because what you don't want to do on the back end is essentially collect information through either an external application or even collecting information so it appears on a PDF, only for staff to then have to move that information back into the EHR. And so that integration is key, and working across different EHRs is truly key as well, to make sure that patients have really consistent experiences and that all the information is put back into discrete fields in a way that everyone can see it and ultimately act on that information, saving that staff time along the way.
Awesome. Thank you so much, Suzanne. Dane, a related question. I think our EHR has some of these capabilities. Given our financial investment in the EHR, shouldn't that be enough?
Yeah, that's a fair question, and that's something that we actually face a lot with a lot of our partners. We hear this commonly, and I think there's several different things that indicate this is not enough. The first thing I'll say is more holistic around EHRs in general, and EHRs were not built to be patient engagement platforms. EHRs were not built to be automation platforms. So I think that's the first thing that when we look at EHRs, they're very, very good at what they were built to do, which is digitize records, open up the opportunity for records to be shared easily with affiliate hospitals and health systems. So they're very good at that, but they essentially digitize those manual processes. So in many ways, that's what the EHRs have done, which is very, very helpful and opens the door to automation, but they weren't built for that. So that's kind of the first thing. I think if we take a step back and think about EHRs, that's sort of probably helpful to kind of reframe the question a little bit. And then the second piece, I would say, because they weren't built, because EHRs were not built with that in mind, they don't perform exceptionally well with, in those areas, in the areas of automation, in the area of patient engagement. And as we saw with the ARC study, as a case study or case example, is we've kind of smattered throughout the conversation today, engagement is the key. If we don't have patients engaged in going through if we have a patient access solution and we don't have patients going through that solution, we're not going to drive results. We're not going to see the benefits around denials. We're not going to see the benefits around better data. We're not going to see the staff benefit of sort of alleviating some of that administrative burden. So I think that's the other kind of key factor. One is thinking about what EHRs, were built to do and what their best capabilities are. And then two, kind of flip side of that is a lot of times we aren't able to deliver the results, or I should say EHRs aren't able to deliver the results just because that's not sort of their bread and butter. That's not what they were built to do. So that's where there is a really big benefit, and gets us to that fork in the road I talked about, where we want to kind of get over the digitization piece and now focus on automation, which is something kind of beyond what an EHR was built to accomplish.
Awesome. Thanks, Dane. The next question we have is for Suzanne. What about older patient populations or patients that don't want to engage digitally? How does Notable serve those populations?
Yeah, I really appreciate this question because upfront we spent a good amount of time talking about patient expectations, and that many patients do want to engage digitally, but we know that there's always folks who are outliers to that, or still looking for a different experience. And I think that's incredibly important and something to think about. One of the interesting things, particularly with Notable, is we actually see really strong engagement across all populations. It's interesting because one of our partners actually helped us test this theory, where they wanted to start using Notable's intake solution in their geriatrics clinic. And it was very interesting to see what the results would be and see, is it different with an older population of patients? Do they interact differently? And we saw at Go Live that over half of those patients were actually completing their intake digitally, and that number was just increasing over time. So it was really phenomenal to see those numbers, even just immediately at Go Live and as it continued to grow. But I think the other important component of that as well is, when you have 60, 70, even 80% of patients who are completing that intake up front, that opens up capacity for staff to engage with those who don't want to engage digitally in person. Right? Because now your staff members can really focus on those patients who need a little bit more attention or need some more guidance and that in-person experience. And so I think it's really true that it's beneficial for everyone when you have intelligent automation on the front end for those who definitely want to engage with that, and that number continues to grow. But it also helps those patients because now staff have more capacity to essentially focus on, patients who need their time. So it really ends up benefiting everyone along the way.
Great, thanks, Suzanne. Perfect segue for our last question of the day for Dane. How have you seen staff react to automation?
I would say very, very positively. A really good question, because the concern could be traditional concern, even consulting background. Oh, well, someone's going to take our job, automation is going to take our job, et cetera. That is not the case, and that's not the response we've seen. We've actually seen staff. We have an example, or a few examples, but one comes to mind where a staff member was actually crying, and we were concerned, thought it could be something negative, and she was actually so happy that we were limiting the sort of monotonous part of her job. She was so excited because she got into healthcare to help patients. There's a lot of other entry-level type jobs, administrative type jobs you could get into. People that choose to take those jobs within healthcare are typically getting in them because they're interested in helping people. They want to engage with people. They want to help people. They want to be part of the solution for someone when, as Suzanne said, they're having a bad day. Another example we hear a lot is, like, when you think about someone coming into the hospital, it's might always be the worst day of their life, and now think about that as someone that's taking that on from the administrative, the patient access standpoint. You're dealing with people that are going through a hard time, so you want to help those people. You don't want to be entering records. You don't want to be manually typing things in all day. And that staff member was so happy that we had eliminated sort of that monotonous part of her job, so that now she could really focus on the, as Suzanne just mentioned, the instances where someone maybe actually really needs help going through the registration. But even for the patients that have went through that digital intake experience, now she can focus on providing, great care, really helping them navigate the complexities that they have to deal with from a clinical standpoint, or just deal with the stresses of being in a hospital for a surgery or a procedure, whatever the case is. So to summarize, we've had very, very positive staff reactions because ultimately we're lifting the burden off of the staff with automation and letting them focus on, 9 times out of 10, letting them focus on the thing they took the job to focus on, which was caring for patients and being there for, people that are going through a tough time. So very, very positive response overall. And from our standpoint, we're always thrilled to see that because that's ultimately what we want to do. We want people to be able to focus on, what's important and not those monotonous tasks.
That's the perfect note to end on. Thank you so much, Suzanne and Dane, and thank you to our audience for joining our discussion today. We hope that you have a wonderful day.
Thank you.